I want you, for a moment, to imagine someone with a disability. Picture them in your mind. I'm guessing that a lot of you are picturing someone in a wheelchair. That makes sense, since that symbol is used in parking lots, in bathrooms, and on websites, basically anywhere where you need to indicate that something is accessible. I'm guessing that a lot of you aren't picturing someone who looks like me, and we're going to talk a bit about that. My name is Sam, and like I said, I graduated last year, and I'm disabled, which will probably shock a lot of you. I was also treated for my disability at the Holland Bloorview Rehabilitation Hospital. But back up a second. What exactly do I mean by disabled? Well, when we look to the definition of a disability, we come to a bit of a roadblock. You see, the federal government doesn't actually have an operational definition of a disability. Rather, they acknowledge that disability is a term that can cover a wide variety of medical and health problems of one's body and mind. It also acknowledges that disabilities can occur at any point in a person's lifetime and can go through stages of remission and relapse. One of the things I really like about this statement is that it's inclusive of invisible disabilities, which, as their name would suggest, are disabilities that you can't see in someone. You can't point them out just by looking at them. My own disability falls into this category. Now, disabilities are seen by the medical community, as well as the majority of society, as deviations from the norm. But is that really accurate? Studies show that 27% of Canadians at or above the age of 15 are disabled. That's 9 million Canadians. Think about that. 9 million Canadians. Now, I came into today realizing that, one, this is a very difficult statistic to visualize, and two, that a lot of you are going to think that this issue doesn't apply to you because you're not disabled. So I decided to run a little experiment to demonstrate otherwise. Some of you will recognize what I'm about to show you. In order to demonstrate the prevalence of disabilities in my life, I ran an experiment on my Instagram. I asked my followers to answer the question, are you or anybody else in your life impacted by a disability? Some of the people in this room answered this question, and the results really surprised me. Of my 430 Instagram followers, 223 of them saw this post. And of those who answered, 75% said yes. That's huge. So to anyone here thinking that this issue doesn't apply to you because you're not disabled, chances are it impacts somebody else in your life. For some context, I was not born disabled. 5 years ago, I suffered from an anterior shoulder dislocation on the right side, which is a fancy way of saying that my right shoulder came out of its socket towards the front of my body. I was immediately rushed to the ER, where they took one look at me and were confused as to why I was there. You see, in my shock, I had set or pushed my shoulder back into place, so it looked on the outside like I was completely fine. What concerned the doctors was the amount of pain I was in. Shoulder dislocations are supposed to feel better after they've been set, and mine didn't. The doctors tried a lot of things to get the pain to stop, and none of them worked. Eventually, I was sent home to rest and recover, and told that the pain would at some point go away. My shoulder healed just fine, so there was no reason 3 months later for me to still be in pain, but I was. That was when the doctors realized that something else was probably going on. The orthopedics team at Sick Kids discharged me and sent my case over to the chronic pain team. Here, I was given a diagnosis of CRPS, or chronic regional pain syndrome. With this diagnosis, I saw more doctors and psychologists and physiotherapists, and was given medications called nerve blockers to help with the pain. This is where Holland Bloorview comes in. The doctors realized that I wasn't progressing, and in my 3 months of treatment, nothing had improved. So they decided that I was going to need more help than they were able to give me. I was referred to the Get Up and Go program at Holland Bloorview for persistent pediatric pain for the last 2 weeks of May 2021 to the first 2 weeks of June 2021. meaning that I was inpatient for a month. The goal of this program is to help kids with chronic pain get back to their normal life. Now, the main question I get asked when I tell people that I lived in a hospital for a month is, what was it like? At first, it was really scary and overwhelming. The first couple days of my admission, I knew I was there because traditional treatments had failed, but that was about it. Eventually, though, I settled into this alternate universe where I spent my days being seen by every specialist under the sun, seemingly. Seriously, on my team, there were doctors, nurses, occupational therapists, physiotherapists, psychologists, pharmacists, dietitians, and that doesn't even account for all the people I saw occasionally or who helped with my admission. My nights were spent in that hospital bed, on the soda unit, or the specialized orthopedic developmental rehab unit. It wasn't all hard work, though. I had a roommate, and when we weren't actively being treated, we would hang out, play video games, do art, see some special guests. As you can see, I think that's Batman up there. We had our phones, and we would use them to call our friends, because unfortunately my admission happened during COVID, so they weren't allowed to come visit. And of course, we had schoolwork to do. Holland Bloorview has a school in the TDSP, so I was able to get my work from York transferred there so I could complete it during my admission. The only caveat is that I was allowed to do a maximum of 2 hours of schoolwork per day. You heard that correctly, maximum 2 hours. Now, to some of you, that probably sounds fantastic. And believe me, I was an IB student, I get it. But when you're in this alternate universe where your days are spent being treated and in all different forms of therapy, anything that makes you feel like a normal kid is a precious commodity. Believe it or not, me being here and speaking to you today is actually 2 years in the making. While there's nothing inherently wrong with writing a card to a patient, the problem is that these cards can often come off as impersonal at best and condescending at worst. To change that, I came up with 2 other ideas for you guys to do if you would like to get involved and help out with Bloorview. The first, which may seem obvious to some of you, is donations. Bloorview does a lot of amazing work, not only for their current patients, but also for research, developing new treatments for those with disabilities, and that research costs money. So any amount that you can give really does help to improve the lives of both current and future patients. The second thing you can do is volunteer. You can do this in 2 ways, either by volunteering with scientists to do research or by volunteering for programs. Grade 11s, I know you're in here somewhere, and I know that some of you are thinking about applying to science programs or thinking of doing research in university. And in particular, if you're applying to US schools or any scholarships, volunteering with one of the foremost research institutions in Canada is going to look fantastic on an application. And like I said, the other option is doing programs, which, in my opinion, these volunteers do more meaningful work than those who volunteer for research, speaking as someone who's benefited directly from these volunteers. I look back on my time at Bloorview, and I'm so grateful for the help that I was able to receive. And I know that you as students have the opportunity to make a difference in someone's life who's in a similar situation to the one I was in. You will have opportunities to sign up to do both throughout the week. Thank you guys for letting me come speak to you today. I'm going to hand this back over to Lily, I think, to continue on with your assembly.